Spices can be used for maintaining balance and preventing disease in the body, or they can be used therapeutically to correct existing imbalances and support healing. Let's understand the distinction, which is the key to using spices effectively. When we are trying to use spices for prevention, we are going to use them on a daily basis. And the purpose is to maintain digestive fire, balance doshas, and prevent the accumulation of toxins in the body. Along with this, we are also aiming to support our immunity so that we don't fall sick in the very first place. Now, these spices are incorporated in daily meals in moderate amounts, forming a cornerstone of everyday preventative health. Such spices are mild to moderate in potency, they are safe for daily use, and they focus on maintaining balance rather than aggressively correcting a disorder. For example, cumin, coriander, and fennel seeds can be regularly added to meals or steeped as tea to support digestion, reduce bloating, and gently balance all three doshas. Turmeric can be used in cooking daily in small amounts, and it can act like a mild anti-inflammatory and immune supportive agent. Cardamom can be used in tea or milk to soothe pitta, calm the mind, and support respiratory and digestive health. As per Dr. Vasant Lad, he emphasizes that preventative spice use is subtle but powerful. Regular inclusion of digestive and balancing spices in meals can strengthen your Agni, keep doshas in equilibrium, and prevent disease from arising, much like a daily tonic or rasayana. The goal is gentle, continuous support of the body's innate intelligence rather than targeted intervention. Now, when we are trying to use spices for healing or therapeutic purpose, we are going to use them actively to correct an imbalance, alleviate symptoms, or support recovery from a disease. These spices are used in specific formulations, dosages, and preparations to address particular condition. Spices used therapeutically are higher in potency and are used in concentrated form. They are targeted for a specific dosha imbalance or health condition, and they are often combined in classical Ayurvedic formulations like churnas, decoctions, or pastes. For example, Trikatu is a very common Ayurvedic formulation of 3 spices, black pepper, long pepper, and ginger, used to kindle Agni in cases of weak digestion, poor appetite, or respiratory congestion. It is not typically used on a daily basis in large dosages for healthy individuals, but it is used to treat specific conditions. Another one is Hing Vashtak Churana, which is a combination of a few spices like asafoetida, cumin seeds, black pepper, dry ginger, and many more of such spices in specific ratio. And this is to be administered to relieve gas, bloating, and vata related digestive disturbances. It's not to be used on a daily basis. Another one is turmeric and black pepper decoction. This is to be taken to reduce inflammation or support joint health during acute episodes. It's not to be taken on a daily basis. As per Dr. Vasant Lad, therapeutic spice use is precise and intentional. Spices are not just flavoring agents in this context, they are active medicines. Proper dosage, combination, and timing are crucial to achieving healing without aggravating other doshas. For example, a pungent spice like black pepper can stimulate Agni and clear mucus, but if overused in a Pitta person, it may worsen heat-related conditions. Spices can be powerful medicines for sure, but using them therapeutically requires proper Ayurvedic knowledge. Incorrect dosage, combinations, or timing can aggravate doshas or worsen certain conditions. For targeted healing, it is always safest to consult an Ayurvedic practitioner or an experienced Ayurvedic Vaidya or a doctor who can recommend the right spices, form, and dosage for your constitution and your current imbalances.